I'm always surprised when, not surprised, but yeah, I always have kind of a reaction when I'm discussing with people, and I see a few VCs in the room, that, you know, yeah, biotech is innovating, but in the end, pharma is developing. This is a concept we have heard over the years, and I would like to say, you know, I think this is changing dramatically. I can just give this example for CRISPR, but it's not only CRISPR. We have access to the very best talent in the industry, and I mean industry, not necessarily pharma, for sure. We can get pretty much anyone we want to get from pharma if there's a match. But we also can get top-notch people out of biotech. And so what we are seeing is that I wouldn't call this a brain drain out of pharma, but we see in parts a brain drain out of certain areas in pharma into these, I would say, still probably startups, not necessarily, but kind of, you know, biotech companies going with new modalities, be it cell therapies or whatever, going now into clinical development or being in clinical development like Bluebird briefly, or around commercialization, registration, whatsoever. And so I think the concept, in particular with regard to these new modalities, you know, thinking that you have innovation in biotech, but let's the big boys do it, I think this is pretty much outdated. Outdated for these kind of assets.